Tanya McLean-Nicholas, licensed marriage family therapist and owner of Renewed Hope Counseling. May is Mental Health Awareness Month, and I'm going to continue bringing awareness to the importance of taking care of your mental health by educating you on the prevalence of mental illness and the stigmas that are associated to it. As well, I want you to know the importance of being proactive and taking preventative steps to keep your mind and not just your body well. So, today's topic is mental illness and your teen, understanding the teenage struggle and recognizing the danger signs. And I'm going to give you some key tips in being proactive and staying involved with your teen's mental health. So go ahead and grab your tea or your coffee, whichever you prefer, and let's dig in. Those adolescent years, they're tough. And for those of you like myself who are parents, you probably understand the roller coaster ride that occurs with being the parent of a teen. Being a teen can be so challenging. There's physical changes that occurred from their growth spurts to the misfiring of their hormones, the emotional and the social challenges from needing to fit in to experiencing the pressures from their peers. And let's not forget about the academic transition and the changing of expectations from home and school. Then let's not mention the things teens cannot control, such as exposure to violence, abuse, and poverty in their homes, and the adults in their lives that are struggling with their own mental health issues. All of these factors can be overwhelming and impact a teen's mental health. The most common mental health issues seen in adolescence is emotional and mood disorders, such as anxiety, excessive worrying, depression, like persistent feelings of sadness, loneliness, or emptiness, maybe some irritability, frustration, and even anger. These problems could also be manifested in physical signs, such as complaints of a stomach ache, a headache, nausea, and you might see it affecting a child's schoolwork. They may even withdraw or even isolate themselves. There are some key signs that parents want to watch out for, such as excessive sleeping. Maybe you'll see some fatigue, low self-esteem, loss of doing the things that they enjoy, loss of weight or weight gain, maybe noticing an eating disorder, changes in their personality, or an increase in risk-taking behavior, such as drugs, alcohol, or even promiscuity. During the adolescent years, it is crucial that children develop habits that will help maintain their mental and social health, such as getting enough rest, proper eating habits, learning coping skills, learning to get along with others, and the ability to manage their own emotions. Developing healthy relationships in the home and at school and the community is also important. All of these factors could influence the outcome of a child's mental health. Opening up the conversation with our adolescents about their mental health is extremely important because it's estimated that about 10 to 20% of adolescents globally experience mental health conditions that continue to remain underdiagnosed and even untreated. Depression is the leading cause of illness amongst teens between the ages of 14 to 19, and suicide is the third leading cause of death among teenagers between 15 and 19. This is why the conversations have to remain open. The stigma surrounding mental illness must be dispelled, and the barriers that stand in the way of adolescents seeking help and accessing care must be removed. Mental health awareness and prevention is all about strengthening a person's capacity to manage difficult situations, to build some resilience, and establish a supportive network. So parents, here are some tips for you. Keep the communication open. Having constant open communication about all topics with your teen is important, but especially topics of this nature. If your teen is struggling with their mental health, it's going to be scary for them and challenging to talk about. So create a safe environment where the discussion of their concerns will not be dismissed or overlooked. Understand mental illness for yourself. Get enough information on mental illness, signs and symptoms, and the resources so you're armed to help your teen or maybe someone else's teen. You can also access this information through your child's pediatrician, your local health department, your faith community, or from your child's counselors at school. Mental health disorders are treatable, and by equipping yourself with the information on the most common mental health disorders among teenagers, you're better able to recognize signs and offer support. If your concerns are serious, discuss them with your pediatrician because so many mental health issues are seen physically. Excessive sleeping, maybe not eating, or even overeating. Your pediatrician can assess the situation and then refer you out to whatever appropriate mental health organization you need. Stay in tune with your teen. Pay attention to their behavior and know their routine. Adolescence is a time for adjustment and change, so expect this. However, when your child's behavior changes abruptly or dramatically, this could be a sign of a mental health issue. Also know their outside influencers, whether it's friends, social media, This will help you set boundaries when necessary. And finally, model self care. Show your teens that taking time for yourself is necessary for mental health. Let them see you taking time for yourself by enjoying hobbies and relaxing, and then encouraging them to do the same. This is vital to maintaining good mental health and overall well being. Well, that's it for today. I hope you enjoyed your tea with tea on this Talk Therapy Tuesday. I'm Tanya McLean Nicholas, and I hope you have a beautiful day.